Biggest myth about health insurance?
I don't know which one to pick. I guess biggest myth is health insurance means you're covered in case of a catastrophic illness. The answer is no. You're screwed. You are absolutely screwed, but you can be covered if you enlist yourself and modern technology in the fight with you and get everyone else on your side. When you go through a catastrophic health situation, a lot of times health insurance is not there for you.
Welcome to The Patient from Hell, the show where we discuss real stories, expert insights, and build a community that every cancer patient and caregiver deserves. Today, we're diving into the world of insurance and caregiving with Neal Shah, a hedge fund turned entrepreneur and social enterprise leader who has spent the last several years trying to enable patients and families to use cutting-edge tools such as AI to appeal denials from insurance, to find support from medically trained caregivers to help you manage dementia and cancer. And we also discuss where the world of insurance has gone and is going, given the advent of new tools such as AI. I think you're going to really enjoy this episode. You might come out feeling a little bit mad at the system and hopefully very, very empowered to take control of your finances. Dr. Shah, thank you so much for being a guest on this episode.
Thanks for having me, Samira. I really appreciate it.
Maybe we start with how you ended up here. I think I read you started with hedge fund.
Yeah. So, happy to share, but I actually found myself in, caregiving in the middle of my career, so my background, I've kind of started in finance, like very early in my career. And by the way, I'm actually, even though I'm wearing scrubs, I'm actually not a physician, kind of by training or by practice. I actually wear the scrubs to empower the caregivers across America that are caregiving on our platform. But I kind of had a non-traditional path to care. I started, managing investments very early in my 20s. At large organizations, and very quickly became a partner at a multi-billion-dollar hedge fund. By my late 20s, was running my own hedge fund by my early 30s. And I fell into kind of care and really cancer care and dementia care by becoming a caregiver within my family. I went through a couple of care journeys for my grandfather through dementia and cancer and kidney failure and end-of-life care, where I was the care coordinator in my family, but it was in my early 30s. And, after he passed, I was running my hedge fund. I became very obsessed with the care economy, and I was like, man, it's really tough to get care. Like healthcare is great, but when you're taking care of someone in your family, there's a lot of social care that falls on the family members. Probably 95% of the care that happens through cancer, through dementia, through any kind of major acute illness or chronic illness is happening by family members. And it's like this informal economy. And I observed it was extremely, extremely difficult and put a lot of pressure on, myself and my family. So I became obsessed with the care economy, and I was still running my hedge fund at the time. And then at 35, real crisis hit home where my wife became severely ill and went through a multi-year cancer battle. And I was her primary caregiver while I was running my fund. And I ended up taking several sabbaticals to manage her care. It was really, really stressful. There were several touch and go moments where, we thought she might not make it. And then I made a very difficult decision to wind down my fund and become her full-time caregiver. Did that for a couple of years, pleased to say, knock on wood, now she's been in remission for a few years, so had a successful outcome. And at that point I was just look, I was in the middle of my life. I was almost 40. And I was like, okay, I now am obsessed with something, that I've experienced a burden secondhand, then firsthand. I have met so many people in support groups that are going through this. And, it is very, very difficult, the amount of strain it puts on the family caregivers. As they say, cancer doesn't strike the individual, it strikes the family. Same with dementia. So I thought, okay, there's something I found that I feel like I can put my energy and my skills to good use to making a positive social impact on people. And take kind of skills I've learned in analyzing tons of businesses, finding where there's challenges and opportunities, within this market, and take my own personal experience and do something socially impactful and meaningful with it. So yeah, that's how I started, kind of my route along this journey of now running two different social enterprises that are making an impact on people going through this in different ways.
Neal, what kind of cancer did your wife have?
Triple negative breast cancer, with a very, very fast growth, and multiple kind of lines of treatments didn't work. And frankly, sometimes the side effects of the treatments resulted in hospitalizations. And at one point, a very severe bilateral pneumonia with sepsis, ICU, in a coma for weeks. So these were kind of like between multiple ER visits. I mean, it was just, there were so many things about the cancer journey that were extremely, extremely stressful.
Yeah, can you tell us roughly how many years ago this was?
She's been in now remission for 5 years.
Wow.
So, knock on wood, yeah. And prior to that, it was a 3-year battle. But, believe it or not, actually, one of the most unexpected things of the journey, we didn't have children at that time, so it was like very, it was very isolating and lonely because we were in our, mid 30s, had, recently been married, and, she got this diagnosis, and, it just became, we lost a lot of friends. I don't think it was even intentional, but, most of the people in their life are, just about to have children or have had children, and they're talking about the positive things. And here we are dealing with this. And I think despite best intentions, a lot of people, sent us food and checked in on us. It just became kind of like the sad thing to talk about. So you kind of like have a little bit of social isolation through that. But where I'm going with the story, where it ends on a positive note, is after her recovery, they said, probability for that happening for us was like very low, like close to zero. And we have a happy, healthy baby daughter who is now 4 years old, which was statistically, I think, less than 5% probability. So that's been like really a miracle. So I'm very thankful and grateful, of the way it happened. But I also appreciate that many people I've met through the support groups did not have, such a fortunate outcome. It has been like, I'd say it has been the transformative event of my own life as well as her life, of going through something this difficult this early on and seeing, kind of like extrapolating from our experience to what is happening to other people.
We have so many things we can talk about, but before we go into that, I think there were 2 things that you mentioned I think is worth us touching on. The first was social isolation.
Yeah.
And loneliness.
Yeah,
I fully relate. I mean, I'm in my mid 30s, got diagnosed early 30s, and that is very real, despite good intentions. I have heard a lot of patients and survivors talk about it. I have not heard a caregiver talk about it. So I'd love to put that hat on.
How long do you have? How long do you have?
Maybe.
I don't want to bore your listeners with it, but I can talk volumes about it.
Yeah, maybe give us the highlights, Neal, because I think it's one of the things where I think it is, in some ways, very obvious it's happening, but in a lot of ways, in the myriad of things the cancer experience does for people and families, I think it becomes kind of bottom of the stack.
Mm-hmm, mm-hmm.
So maybe you want to talk about it from that perspective and specifically how you've rebuilt community.
Yeah, sure. So I think the social isolation, and I think a lot of like my post, like the caregiving journey has been a really impact on caregivers, that I believe it's one of the profound crises of our time, because, there was a report that came out a couple of weeks ago, I think research by AARP, that, they had estimated a couple of years ago that there are 48 million people in America caring for somebody in their family with serious illness or disability more than 10 or 15 hours a week. The new updated number is 63 million. So it's like over 1 in 4 grown adults, over 1 in 5, almost 1 in 4 adults are doing this. I think the caregiving journey is extremely isolating and lonely. And I'll say why. I mean, there's a couple of reasons. One, I think when you have a person going through cancer, of course, there's going to be outpouring of empathy, for the patient. Oftentimes there's support for the caregiver, but there isn't as much direct empathy directed towards the caregiver because the other person is the one that's suffering from the illness. So I think the caregiver is often, it's interesting because the caregiver is overlooked in that journey. The caregiver is often also overlooked from a work and professional career journey, where like if somebody is seriously ill and they're taking time off, tons of, medical leave policies, tons of empathy from colleagues. No one's going to be thinking, while you're out on cancer, your job's going to be replaced, right? That's not. But now take the exact same situation of the person providing the care. Despite good intentions, way less. Like, where is the structured paid time off to take care of someone going through major illness? Where is that kind of like, your role will still be here, when you finish your care journey? So I think that is kind of like difficult. And then kind of like the other thing, just from my own personal experience, I would observe, I was a male in New York City in finance in my mid 30s. as you can imagine, a lot of people are like, okay, there's a traditional stereotype of who does care and all that, so, and I think this is changing societally, but there's still like maybe a stereotype of a 35-year-old male finance guy. A lot of my friends did not understand or relate, and were kind of thinking, why weren't you just getting somebody else to do outsourcing kind of the help? And, I think that is extremely lonely and isolating. That sometimes if you're in a high ambition career trajectory younger, and you then take a significant amount of time off and fully postpone your own ambition to take care of a loved one, I think sometimes it's viewed as like weak, or something that other people don't respect, and that becomes extremely isolating. But it also, in some way, it wakes you up to reality of life, and I think it also makes you rethink the priorities of who you know. So I think for me, I'd say I kind of like went through the experience, but also I learned a lot about myself. I learned a lot about others. And, I hope that can be used to inform and build better system for other people who are going through this.
Neal, I'm and there was one more thing you said that I did want to touch on. When you were describing your wife's experience, you mentioned there were several touch and go moments, several ER visits, one of which was that led to the ICU and then coma.
Yeah.
I imagine that if all of the touch and go moments, that one potentially rises to one of the top.
To the top, yeah.
Can you talk about that for a little bit more, but specifically from the role you had to take on?
Yeah.
Decision making, communication with the clinicians.
Yeah.
Power attorney, no power of attorney, advanced directive, no advanced directive.
Sadly, no preparation, went into the thing with, we were not planning on any of that stuff. So yeah, it thrust me into like a very complicated role, of like responsibility for somebody else's life, responsibility for a lot of decision-making, which is like hard. A lot of like, of course, like her family, my family, like everybody at that point traveled, like none of our families are from the area. So everybody traveled, to there, but yet I was the one who had to make the calls, for her when she could not make them. It was a highly, highly stressful, so I would say, first kind of like unexpectedly happened in the, middle of our care journey. So just immediately dropped everything, took a major sabbatical from work. And at the time I was running my fund. So it was actually quite stressful because I was the primary person that was responsible for the organization. But because of a major kind of acute emergency, I basically disappeared for a month. And it wasn't a month vacation. It was a month of like extremely high stress. This responsibility for decision making, I would say I've never been in that situation before. I feel much more prepared now to be in that situation for someone else. But at that time, I felt completely unprepared. And I had to make several decisions about procedures that were to be done, which could have had a huge impact on the outcome. Thankfully made decisions that resulted in, non-disaster and a recovery. But had I made a different decision and something bad had happened, I'm not sure how I could live with myself after the fact, So I think that some of these situations I now see, because I'm now helping thousands of people manage caregiving, I now see how difficult these things are when you're placed into them. And many people make decisions that don't turn out well. And it's not due to their fault. It's just a lot of times it's external circumstance. A lot of times it's luck. A lot of times maybe the decision was wrong, but they didn't have enough information to make the right one. And it is a tremendous amount of strain to make a decision that could impact someone's life, that is especially your loved one, and they're not able to make the decisions themselves. That's one thing about the journey that thanks for asking the question. I actually haven't even thought about it since it happened, actually. So I appreciate asking the question. But we were not prepared for that at all. Like there was no kind of advanced directive, no care planning that had happened to that point because the situation was so unexpected.
The reason I was asking you is I think so I studied burnout, specifically caregiver burnout. That was my thesis.
Wow.
And I've spent hundreds and hundreds and hundreds of hours looking at caregivers, the informal caregiving economy, and then specifically in the context of the professional caregiver, i.e. clinicians, right?
Yeah.
And I think the piece that we as a society do not wrap our head around is that the spectrum of responsibilities on the caregiver is huge.
Yes.
Right? You're dealing with everything from like emotion, morale, being a good spouse, all the way through like actually making medical calls.
Yes.
And for the vast majority of times, I don't think caregivers are prepared. Right? I've actually never heard a caregiver tell me they're prepared. I'm like, you just don't, right? Like, you don't sit and prepare for these things. And I think we kind of as a society miss the diversity of impact on the caregiver.
Yeah, I think if I had to summarize it in like one phrase, the experience changed my personality.
How so?
Prior to that, I was a pretty happy-go-lucky person. Like I'm pretty, like, I'd say analytically intense. Like I like to read. I have a very long attention span. I'm obsessively focused on certain topics, and that's why I had a thriving career in hedge funds and investment management, because I would like really learn about industries and go deep and kind of think through strategy. But I'd say personally, I'm like was, and to a degree am, but like a pretty happy-go-lucky person. And after the experience and the unbelievable amount of extreme stress during the care journey that then just kept going and going and going, I think that I have like maybe become more anxious, as a person, like a lot more worried about things that could go wrong. And I think that sometimes up until that point, just like openly optimistic and not that worried. And now like very kind of careful about what if this happens? What if this happens? And I think that's just kind of like in the back of your mind. But I think that, I see it in myself and I try to channel it for positive. But I have like been in so many caregiver support groups where I've observed people's personalities completely change, and often not in like ways that they can manage it for positive. Sometimes it has a detrimental impact on them. No,
I very much relate. It's kind of like waiting for the shoe to drop.
Exactly. Yeah, I'm constantly like waiting for the shoe to drop. Yeah,
I definitely relate. In fact, right before we hit record, I had a friend tell me she's going through a thing, and I was like, "Oh my god, no!" It's constant.
Yeah.
So anyway, that experience, not great as it is or was, it transforms you. But there's, yes, I think, a couple of specific ones in there, including the financial side, that I think transform you maybe in a more directed fashion. So can you talk about that?
Yeah. I think that the financial toxicity of like going through a major illness, whether it's like something like dementia, something like cancer, and whether it's you are the person going through it or you are the person taking care of someone going through it, I think it's like one of the biggest kind of like untold things in society. Like I think we often focus on like we have a great healthcare system, we have treatments for a lot of stuff, we have like great machinery, procedures, hospitals, but the financial toxicity of this stuff, and let's say specifically focusing on cancer, I think is like really untold. Of the challenge it puts on first the person going through it, right? Like many times people go through major cancer battle, and if it's not straightforward enough, they usually have to leave their career. So now they're out a lot of income. In our case, it was severely stressful and prolonged to the point where then I left my own career. So like both of us were just like living off savings. Thankfully, we were in like, good enough positions before where you could kind of pull that off because we were fortunate enough to have made income and socked it away, but you were still just depleting savings for several years. So there's financial toxicity of that. Then there's financial toxicity of the caregiver burden and getting care help. So I kind of like devoted like the next phase of my career to helping people get affordable kind of respite care, because that was like unmanageable. Like to get a caregiver so you can get a break, whether you're taking care of somebody through cancer, somebody through dementia, in most cities now is costing north of $40 an hour. And by the way, to be diplomatic, but I'll just say it since I'm pretty transparent, the care still sucks. Like you feel really, really guilty where you're like, I'm paying $40 an hour for this person to be taking care of my loved one. And this person doesn't even really want to be here. They're goofing off on their phone when I get home from work, whatever, right? So, you're depleting so much money doing that. And then the financial toxicity of navigating the bills. I mean, if the cancer doesn't kill you, the bills are going to kill you, because whether it's hospitalizations, whether it's, ER visits, in this case, ICU, cost of therapies. I think fighting the insurance companies when you have like a major illness is about as hard as fighting the illness. And it is very sad that people are doing that simultaneously. So, that has like really woke me up to the struggles that it's like Tale of Two Cities. We have some of the best healthcare in the world. We also have some of the worst healthcare in the world. And maybe healthcare finance or care finance is, I think, a sector like ripe for improvement, to say it mildly.
Neal, so before we dive too deep into, I have so many math questions for you, by the way, just given that I'm talking to a fellow analyst here. But before we do that, you wrote a book.
Yes. Yeah, I have it right here.
What made you write the book?
Insured to Death. How, speaking on this topic, Insured to Death, how health insurance screws over Americans and how we take it back. And you can see that claim denial letter here, and the shadow is what they're really doing, which is shooting you. And I think that, what made me write the book was actually, both my own lived experience and the lived experience that I see thousands and thousands of people facing. Subsequently to my own cancer journey, or my wife's own cancer journey and my caregiving journey, I started a care platform that has now scaled across the country, helping thousands of people get affordable care. And it's a full social enterprise. We don't make any money. And we connect people with wonderful caregivers who are all healthcare students. So that's the logo I'm wearing, that's what the platform is. So pre-med students, nursing students, et cetera. And I see firsthand what these families are dealing with. And it is absolutely heartbreaking, absolutely heartbreaking. The cost of care is already absurd. And the families are pulling together what the savings they have to manage. But the denials of healthcare from insurers, I think, has gotten completely out of control. So what catalyzed the book was, in the last 3.5 years of running the care platform, seeing all the individual stories, me kind of being able to empathize and relate to what the individual families are going through of oh, wow, this has happened to me before, this is happening to this person, except they're oftentimes not in a great financial situation. When somebody's medications got denied, when somebody's physical therapy got denied, when somebody's, hospital bills, procedures, all of these things are getting denied. Then observing that it's been escalating in the last few years, I think, one of the theories I wrote about in the book is that I think the insurers have weaponized AI, and average people have not, so it's anytime new technology comes out, I feel throughout history, oftentimes bad people start using the new technology for bad things. And, it takes a while to be distributed broadly to the population. So I think that that's been a key thing. And then really the biggest catalyst, I think, was the CEO of the largest health insurance company in the country got shot in broad daylight. And the reaction by the majority of the population was not one of empathy, but rather glee. And I think perhaps that was a social signal that maybe the system is very broken. And I think to me, that the catalyst of that was it made everyone suddenly realize that it's not just me, but all these other people. Because when you have these things, you don't talk about it. You don't talk about it because it's kind of embarrassing, right? It's embarrassing if you're fighting a denied bill. It's kind of an acknowledgement of, I don't have enough to pay this, or, I feel there's so many variables there, because if it's a broader acknowledgement of illness, it's a broader acknowledgement of specificity of what was denied. And then it's a broader acknowledgement of why don't you have kind of the finances to, deal with that? So I feel that's there's a shame component to it, which is a reason many people keep it to themselves. So I think that was really the catalyst of when that happened. It kind of let the cat out of the bag across the country, that many people are oh, other people are dealing with this too. And then I think at that point, it was okay, there's something huge here that so many people are dealing with it. I think all of those things led to an inspiration to kind of write a book about it, went in depth researching and almost obsessively figuring out the topic. And I really wanted to kind of provide fuel for myself of how can I help people who are going through this? How can other people potentially read up on this and be inspired to help in their own way? But I think that there is a peaceful, nonviolent way to solve the problem. So I think that was really kind of I find now a broader kind of thing that a lot of people are losing faith in institutions in our society. Partly it's because the institutions are not working and they're not serving the need. But I don't want to kind of embrace a nihilistic view of just kind of destroy everything, which I understand sometimes younger people have that vibe. I feel this should be used as a optimism for let's fix it. Let's fix it, or let's build a better one. But let's put our creative energy to good use, not just advocate for destruction, So I think that was really the motivation.
Neal, you said something that I would love to unpack. Weaponization of AI.
Yes.
Please say more.
Okay, yeah. I mean, where do I start? Cigna has been busted in an investigation for 300,000 denials in averaging 1 second. It's like basically with no human oversight. Like there are so much. United Healthcare, somebody won the Pulitzer Prize, I think, a year ago for Medicare Advantage denials of older adults who are living in skilled nursing facilities. 90% denial rates among some patients because they were guessing that this person didn't have anyone to fight back, or the facility was short-staffed, so they could just kind of get away with it. So I think that the kind of AI being used to inform care financing decisions, whether it's prior authorization or post-care denials, all the insurers embraced AI first and fast and took the human element out of it, which also arguably, because some humans might be gagging over if they had to deny this stuff, I think sometimes there's a moral boundary that many people, even if that's their job, they can't cross. The AI has none. So I think a lot of the insurers have weaponized this over the last few years. And I have several examples in the book, and there's tons of examples, of just amazing investigative journalism that's been done over the last several years. But when the insurance has a tool that can deny a claim in a second, and you as a patient, a family caregiver, or a clinician have to spend 2, 3, 5, 8 hours to detailed research something and create a robust case for an appeal, there's no chance, right? It's like an unfair asymmetric battle where it's like somebody has a gun and you have a knife. There's no way you can win. And I think that the AI and programmatic escalation of denials is resulting in a lot of second and third order effects of, patients being denied a lot of care, not being able to fight back. 99% of people individually will not appeal a denied claim because the burden is too high. Clinicians are now drowning in this stuff, like doctors, nurses, nurse practitioners, PAs are spending sometimes upward of a quarter plus of their week navigating this bureaucratic process. The cost to independent clinics, the cost to rural hospitals, big hospitals, averaging $45+ of staff time to appeal a denial. So I think that this is it's breaking the system in a way. And it's gone completely unchecked. So I think that until regulation catches up, my kind of observation is we're going to need impact innovators figuring out ways to weaponize AI for the good guys, and I think that arm the resistance, that's kind of that's my one call to action from the book is that, as everybody should know their rights and everybody should figure out ways to kind of do this yourself. But we also need people in society to step up and arm the resistance.
I'm smiling only because I'm so used to hearing battle analogies for the medical side of this. I'm not super used to getting the battle analogies on the insurance side. I mean, it makes sense. I personally definitely relate to that, but I'm just not used to it. So I do think it's an untold story. And I do think it's for the impact it has in the world, it is relatively hidden, actually.
Yeah. People really underappreciate that. Having insurance nowadays doesn't mean a lot, doesn't mean a lot, right? It's and the extreme bureaucratic battles that people have to do to get care. I mean, it's interesting. You're seeing it on social media platforms. I'm actually very encouraged that I think people are starting to feel comfortable coming forward. You're seeing this all the time on LinkedIn now. You're seeing it on Instagram all the time now. You're seeing individual patients openly share their stories of massive denials of care. And literally within a day or two of things going viral, the insurers are reversing the decisions. It's administrative error, really? Somebody called it out. And then, same with Instagram, you're starting to see movement. TikTok, I think you're starting to see movements where clinicians are sharing their stories, patients are sharing their stories. But I think it's gotten out of hand. And now I think New York Times, Wall Street Journal, major articles are coming out of the dramatic skyrocketing denial rates across the country. It's kind of ridiculous. And I think that, I talked to some, former retired insurance executives, and they were like, 15, 20 years ago when I was running XYZ organization, the denial rate was 1%, 1.5%. Now the same organization has a 15%, 18% denial rate, so it's something's going on, and it's kind of gone unchecked. There's no penalty. There's no penalty for a frivolous denial besides overturning it and paying it out. So if you have that type of incentive structure, why wouldn't people just kind of deny everything?
I have a lot of questions for you. Yeah. I'm cognizant of the time we have. Oh, I have way too many questions. This is not going to work. Okay, let's go back. Let's go back. Because there is a question I want to talk about, because you've dropped a couple of numbers here. And I want to sort of link the stories, because I think there are almost two parallel threads here, right? There's the insurance thread, which affects, of course, the patient, the family, but it really affects the family, right? The insurance piece, the financial piece, it's a household thing. I don't think it's an individual patient thing, just because of the numbers we're talking about, right? We're not talking like $200. We're talking tens of thousands of hundreds of thousands of dollars. Like we're talking huge sums of money.
Yeah. Medical bankruptcy is the #1 leading cause of personal bankruptcy in the country, right? And it's oftentimes because of a cancer diagnosis.
I was going to say, what is it? 2/3 is cancer or some crazy number, if I remember the number.
Yeah, it's a very high number. Yeah, I can't remember the exact number, but it's like, I think over half off the medical, and it's like crazy. And that is sad. And the vast majority of those people have insurance. Think about that.
That's crazy.
Right? This isn't the uninsured, it's the insured.
Yeah.
So then it begs the question philosophically, what is insurance? I've thought about that a lot. What's the point? Right? Like, what's the point? Like, and I wrote a opinion article about this a few weeks ago on like US News. And I was like, literally, in analyzing systems, what if we just got fully rid of health insurance? Like, and all of it was self-directed, like all the tax subsidies that are being given right now for employer contributions to health insurance, as well as like all other mechanisms of like, whether it's Medicare Advantage, all these are subsidized programs that are going to for-profit private health insurers, right? What if all of these things, consumers could just kind of tax defer, sock away some money into health savings accounts, and then there was some catastrophic coverage provided, whether it's by government or by, kind of like a robust private sector, combined with people of lower means were just directly given the deposits into their savings accounts. Like there's a way to shift the system to get rid of the role of this kind of like middleman that has a incentive to deny care, raise prices, and pocket profits from what's being denied. I think there's a way to kind of get rid of that, and that might just make a lower cost healthcare system that actually works better for people and doesn't result in all these disasters. But I really think that the idea of insurance is a misnomer, because it's supposed to mean that if something bad happens to you, you're covered. No, that's not what's really happening to the vast majority of people.
Neal, any country that has implemented a version of what you're talking about?
Yeah, Singapore. Yeah, Singapore has like implemented a very successful system that thrives on health savings accounts that have tremendous tax benefits that citizens can shield, pre-tax income into them. It has implemented a very robust social safety net of funding them for lower income citizens directly from government, and for elderly directly from government. And then part of that self-funded account is then used to purchase catastrophic insurance, which is then provided at scale, so that so it's almost like everybody has a certain amount built up in HSAs. And then if a disaster happens, your catastrophic policy covers you. And overall, the statistics are US spends, I think, 18% of GDP or something like that on healthcare. Singapore spends 4.9% of GDP on healthcare and actually achieves more than 7 years longer life expectancy. So it's a more efficient system that people like, that cost a fraction, by removing the perverse incentives of this kind of administrative, middleman healthcare finance layer, which effectively, that's what the health insurance companies are, right? There's just like healthcare finance companies that are taking a huge cut and now dictating how the system works, right? Like they're dictating how physicians practice, they're dictating what patients can get, and they own a lot of the intermediate. I think the other interesting thing is over the last 15 years, the health insurers have like vertically and horizontally integrated like crazy. So I think that it's become kind of like, the small thing that, I hate to draw the analogy, but let's say it's parasite, call it what it is. The parasite is, kind of leeching on the host, which was the American society. And now the parasite of health insurance is becoming bigger than the host itself. And at some point is going to kill the host. So yeah, I think it's a very suboptimally designed system, what we have.
This is a very bleak podcast.
It can be positive too, but yes. I hope that it inspires people to put their creative energy into building a new system. Yeah.
The funny part of this whole thing, Neal, is I work in the oncology space. I'm still stuck on weaponization of AI. I think it's part of the story that I don't think we as a society actually talk at all about, especially the narrative around ChatGPT and OpenAI and Anthropic and like pick your flavor of AI tool, and how there's a narrative of jobs being cut.
Yeah.
But there's not a narrative of a society where decision rights are basically completely taken away.
Yes.
Which is, I think, what you're talking about, that reality is kind of unfolded, but is very hidden right now.
Yep.
And the way to combat that outside of the individual patient leveraging basically social media and public media to fight back, there really is not a way to truly fight back, because the tools available are your ChatGPT and Claude and 15 iterations of the underlying models, right? So anyway, I'm still emotionally stuck there.
Yeah. Well, I'd say not to just take it totally down a negative path. I am seeing very encouraging signs of positive path of people are empowering themselves. And that's what, I kind of really wrote the book because I want more people to feel empowered. Like we've built a bunch of AI tools to help people that we're just kind of giving away for free. But I've also observed a lot of people leverage AI for their own sake. And I observed this, as early as a year and change ago. People that are drowning in denials started uploading a lot of documentation into basic tools like ChatGPT, Claude, etc., and started figuring out and prompting and asking, what do I do? And you know what? It's not perfect, but even those basic AIs are better than nothing, because people don't have, kind of their brother is a doctor and can spend 10 hours writing a letter, right? And especially in whatever, it's unless the brother is an oncologist for that specific thing, they may not even know. So I think in this case, the AI was helping him kind of navigate an appeal. And then, we saw people are winning. So it was kind of that was the eye-opening thing, is that now a tool is out that is making something accessible in what is effectively an AI versus AI war. And if you're not learning how to use AI, you're going to lose. So we've seen kind of inklings of that. Now, where I suspect and predict the second wave will go, which is a lot of efforts we were doing inside our care platform, is we just took a bunch of those AI tools and helped people fight back. Yeah. And we're wow, patient empowerment, I think, and caregiver empowerment is a big kind of thing we can do here of teach people how to use tools. And then now a wave is, we have created those into kind of a product. We've seen other people productize these tools. Now, I think there's a range where some people are productizing it at very high prices. We're just kind of full social impact, so we're just giving it away for free. But I think, and frankly, that's the beauty of AI, is beyond the upfront software development cost, each iteration is dirt cheap, pennies. Correct. So, if you can kind of be a AI patient advocate and help somebody navigate this financial toxicity at pennies on the dollar, that is unbelievable impact, and we've observed that. We have a lot of conversations with various kind of grant making organizations who love these type of projects. And, it's been awesome to see people fund our own projects, but we've seen other projects get funded too. I think this is going to be the new wave, is that there's going to be kind of AI driven patient empowerment. And whether it's through, I think it's in other realms of healthcare too, but I think specifically where we focus on is caregiving burden, financial toxicity of diagnosis. I think that there's a lot of help coming. So that's kind of a cool, benefit of AI.
I like the transfer there of negative to positive emotion. Appreciate you for doing that.
I'm generally a very optimistic person. So I have dealt with very painful and difficult experiences in my life, but I like to think that there's always a way out. And when you find the way out yourself, it's your responsibility to help other people find a way out.
I very much relate. Very much. All right, sir. We're almost at time here. I'm going to do rapid fire.
Sure.
So quick questions for you. Short answer is, okay. One thing every insured American should do today.
Oh man, learn your patient rights. Well, buy the book, so I'll put a plug for the book, but I'll give it to you for free. I don't even care about making money. So email me and I'll just send you a free copy. But we just kind of put it there as easy to list online. But check out the book. I'm happy to send you a copy. So LinkedIn me or email me. I'll share the info. But I laid out a list of things there of if you find yourself in a situation where you get any denial, never pay the first bill. And there's another great book on that too, by the way. That was written by a famous journalist, but never pay the first bill. But I have a whole series of things of all the rights you have to appeal, escalate your appeal within the insurer, force the thing to external review, which very few people know about, dialogue with your state insurance commissioner, and then take it to litigation if you have to. But there are so many rights. And most people, patients, caregivers, do not know those rights. Most people give up. They either pay it, or if it's too big of a bill, they let it go to collections. You don't need to do any of that. You have a ton of rights, and we see people taking those steps, and over 70, 80% of people are winning, which is amazing. but 1% of people are bothering to do it. So my number one thing is, let's get that 1% up to 10%. Let's get it up to 20%. Let's get it up to 50%. Let's get it up to 100%, but the insurers are taking advantage of your lack of knowledge about your rights, and they're taking advantage of your inertia and your intimidation to not fight back. But there are a lot of people who can help you fight back. And I actually think in that case, the insurance commissioners, people are on your side. That, it's like you just have to take the action.
Biggest myth about health insurance?
I don't know which one to pick. I guess biggest myth is health insurance means you're covered in case of a catastrophic illness. The answer is no. You're screwed. You are absolutely screwed, but you can be covered if you enlist yourself and modern technology in the fight with you and get everyone else on your side. But now health insurance is kind of there as a joke, for basic day-to-day life. But when you go through a catastrophic health situation, a lot of times health insurance is not there for you. And I think that's a huge, huge myth. And many people, I'd say, sorry, if I can answer a second thing on that, for especially older adults, anyone in the audience listening that's above 65, Medicare Advantage is Medicare disadvantage. Do not stick to traditional Medicare. Unless, the best way to play the thing is go to Medicare Advantage when you're above 65 but super healthy and enjoy all the perks. And if you can anticipate when you're going to have illness, switch back to traditional Medicare, because you will be screwed if you're on Medicare Advantage. So it's actually a really bad thing for the system, because it's like all the profits are going to private insurers' pockets, and then people are going back into Medicare and jamming the government. And then meanwhile, while you're on Medicare Advantage, they're upcoding and charging the government extra. So now I think the system is completely flawed. And I think even the original architects of Medicare Advantage have taken the position now. I saw an op-ed in The Hill a few weeks ago by the original architect of Medicare Advantage saying the system is a tragedy and not why he created it. And I think that's kind of really telling.
A phrase or an idea that kept you going during your care journey?
I guess an idea that there is hope, and actually an idea that there is, through a traumatic experience, something positive can come out of it, which might be something you didn't expect, which is a opportunity to help others. I think that's kind of an idea, that kept going, especially through dark times. I was kind of planning, what am I going to do after all this, and how am I going to take the experience to good use? And I think that was that really kept me going through the process.
Being a patient from hell means?
How about, can I be patient or caregiver is in hell, because it's yeah, I think, it's they're not from hell, they're experiencing hell because of how bad the system is. But I'd say, the hell of the system, I think, when you're a patient or a caregiver, is there is a unbelievable lack of social support, and I think that is not due to fault of individuals, but I think it's maybe due to the way society views caregiving. I actually think I'm sorry I missed this in the interview, but I think my kind of life's mission is, through the experience, is that how can we uplift and support caregivers across the society, not just in let's give you some more money and let's create this new provision in a health insurance law or whatever, but let's change the narrative in society that caregiving is a natural part of life. And it's not something to be embarrassed about. It's not something to be ashamed about. It's not something to hide from your boss or hide from your employer. It's something that should be recognized and rewarded, because I'd say the biggest healthcare workforce in America is this 63 million people who are doing it every day with no pay, and they're doing it out of love, out of duty, out of responsibility, out of whatever other means. But they outnumber the actual paid healthcare workforce by 50 to 1. And without the invisible work of all these caregivers, the society would collapse. Who would take care of all the older people? Who would take care of all the middle-aged people with serious illness, chronic illness? Who would take care of all the children and young adults with disabilities? Who would take care of all these people that can't care for themselves? So I think that's a invisible thing that's the backbone of the economy and the society, and it does not get enough respect, support that it deserves. So I think that, we need to change that.
Neal, thank you so much. This has been such a pleasure. I have learned so much from you, and I really appreciate you doing what you do, for writing the book, and for encouraging people to take charge of their finances. So,
thanks, Samira. Thank you so much for the opportunity. I really appreciate it.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Mantacares Inc. or Mantacares' sponsors.